What if you could stop a migraine before it ruins your whole day? Imagine stopping your migraine in its tracks before it gets a chance to take hold. Sounds almost like a superpower, right? It's not. It's something that I have been able to master, and so can you. Is it really possible? Yes, and you can with the right rescue medications and the best strategies. Hi, Dr. Cardiel here. I am going to share something game-changing from my own life that could change yours. I've had migraines since I was a teenager, and for years I felt like they controlled me. But once I learned how to use rescue medications properly at the right time and the right way, it absolutely transformed my life. Honestly, it was like flipping a switch. I went from dreading the next migraine to feeling like I had a plan to fight back. I've taken that lesson into my practice, teaching my patients how to master their rescue strategy. So let's talk about how you can get there too. What do I mean by rescue medication? A rescue medication is also what we call acute migraine medication. The goal is to stop the migraine as soon as possible. Now, the best way to think about it is to think of it as the fire extinguisher for your headache. You want to grab it at the first sign of smoke. This is different from preventative medications, which you take daily or regularly to reduce how often you get migraines. We'll cover those preventatives in another video, but today is all about what we call the rescue strategy. Not all rescue medications are created equal. They come in a few different categories, and they can vary in how fast they work, how long they last, and also in their potency for migraine. Let's start with simple pain relievers like acetaminophen, that's Tylenol, and NSAIDs, or non-steroidal anti-inflammatory drugs like ibuprofen or naproxen. These are often your first line of defense. They're great for mild or moderate, not fully evolved migraines, especially if you catch the migraine early. Acetaminophen can kick in pretty fast, often within 20 minutes, but its effects may not last very long. Acetaminophen is generally a lower potency drug when taken by itself for migraine. NSAIDs like naproxen or Aleve, or ibuprofen like Advil or Motrin might take a little longer to start working, maybe 30 to 60 minutes, but they tend to last longer in your system than something like Tylenol. They also tend to be more effective than acetaminophen. In fact, one common strategy is to combine a fast-acting drug with a slower, longer-acting one. For example, you might take acetaminophen for quick relief with naproxen to sustain that relief. There's even a prescription combination with sumatriptan, a migraine-specific drug, plus naproxen for this reason. Guidelines say this strategy can prolong pain relief and limit the headache from coming back later in the day. Another option is what we call combination over-the-counter medications. Excedrin migraine is a famous one. It combines acetaminophen, aspirin, and caffeine. Why caffeine? It turns out caffeine can make pain relievers more effective. It helps constrict blood vessels and boosts the absorption of other medications. In fact, studies have shown that the combination can be very effective for migraines. So if you take Excedrin at the very start of a migraine, it might knock out the headache for some people. But, and this is important, these combination drugs can be a double-edged sword because they contain multiple ingredients, especially caffeine or other short-acting components like acetaminophen, that if you use them too often, you might get rebound headaches. More on that in a moment. For these short-acting drugs, I like to use number 8 as what I call the magic number. This is the maximum number of days per month that you should take them to rescue yourself from a migraine. Short-acting medications are fast, so we like that about them, but they can cause rebound, and that's the problem with them. So let's talk about a third category, the triptans. These are migraine-specific drugs available by prescription. Names include medications like sumatriptan or Imitrex, razotriptan like Maxalt, elatriptan like Relpax, and a handful of others. Triptans have been around since the 1990s, and they revolutionized migraine treatment. They work by binding to serotonin receptors in the brain, which reduce CGRP, a pain-triggering peptide, the overactive pain pathway we talked about in the video where we define what a migraine is. In plain English, they actually target the migraine process, not just the pain. Triptans can often stop a migraine within 1 to 2 hours for many people. Some are faster acting than others. For instance, there's an injectable sumatriptan that can work in 10 minutes, and nasal sprays, while pills might take longer, 20 to 30 minutes. We do like fast relief, but there's always a price to speed. Those fast-acting medications tend to wear off quickly, and so migraines can sometimes recur a few hours later. There are a couple of longer-acting triptans like probatriptan and naratriptan, which don't work as quickly but tend to stay in your system much longer. That makes them useful for migraines that are more predictable or that tend to rebound, like menstrual migraines that tend to repeat the next day or two. I tend not to favor those because they are slow, and to take them at the right time is more challenging with them. So I prescribe those in specific scenarios when the patient has a predictable migraine pattern like menstrual migraines. Now, when it comes to rescue, one guideline even recommends that for longer or particularly tough attacks, using a long-acting NSAID like naproxen together with a triptan can give more sustained relief. I do this myself. If I take rizatriptan, I often take it with naproxen. The rizatriptan knocks out the pain very quickly, and the naproxen helps it stay gone. A quick note on safety: triptans cause blood vessels to temporarily narrow or constrict. So people with certain heart or vascular conditions like uncontrolled high blood pressure, a history of heart attack or stroke, generally should avoid triptans. For everyone else, they're considered pretty safe, but always discuss with your doctor to make sure they're right for you. Triptans can also cause side effects like warmth, tingling, flushing, or tightness in the chest or throat. These are usually short-lived and not dangerous feelings one can get with them. Not dangerous, but can be scary if you're not expecting them. Another type of rescue is what we call the Gepants. These are the new kids on the block for acute treatment. Gepant is a funny nickname for a class of drugs that block the receptor for CGRP, or calcitonin gene-related peptide, which is one of the key chemicals involved in migraines. You may have heard of CGRP because there are also preventative migraine injections targeting it, but Gepants are pills or a nasal spray that you can take when a migraine strikes. Examples include Ubrogepant or Ubrelvy and Rimegepant or Nurtec. Those were approved in the last few years. There's also a newer nasal spray called Savagepant. Here's what's exciting about Gepants. They can work quickly, not always, but some people feel better in as soon as 1 hour, and they tend to last for a good chunk of the day. Even more, they don't cause rebound headaches the way other older medications can. Now, they can be slow to work. From my experience, slower than the categories we discussed earlier. Now, the low risk of rebound is huge for people who have frequent migraines and worry about medication overuse. So if I want to stop a migraine early and decrease the number of days per month that I take a short-acting migraine rescue medication like a triptan, I may choose to take a Gepant earlier on. Studies so far show that Gepants do not cause rebound and also may decrease your risk of migraine recurrence for over 24 to 48 hours. So certainly much longer acting than the other categories. Another plus, Gepants don't constrict blood vessels, so they are a safer option for those who can't take triptans due to heart issues. On the flip side, they're still pretty new and they can be expensive if your insurance doesn't cover them. Common side effects are usually mild, like sleepiness, dry mouth, or nausea in some cases. I've had patients who couldn't take triptans try a Gepant and say, wow, this is really what I've been missing. It doesn't work for everyone, but it's a great development. One other category is the Ditans. There's a newer migraine pill called lasmiditan or rebound. This is in its own category called Ditans. It's a bit like a cousin of triptans. It also targets serotonin receptors, but a different subtype. The key thing about lasmiditan is that it does not constrict blood vessels, so it's another option for those with cardiovascular concerns. It can effectively stop a migraine, but it tends to cause more side effects than the other options like dizziness, sedation, or sleepiness in some people. In fact, if you take lasmiditan, you're advised not to drive for 8 hours because it can impair your reaction time. So it's effective, but you basically need to stay home and rest after taking it. Other rescue medications are acute treatments like ergotamines in nasal spray or injection, which are older migraine medications still used for certain cases, and anti-nausea medications, or even steroids for status migrainosus, which is a really prolonged migraine. But to keep things simple, we'll stick to the more common options since those cover most typical situations. If you're finding this information helpful, don't forget to like the video and subscribe to the channel. The bottom line is you have a toolbox of rescue medications ranging from over-the-counter pills to specialized prescription drugs. The goal is to find what works for you and use it quickly and effectively when a migraine strikes. What does the research say about these treatments? Plenty. Medical guidelines and studies back up what I just said. For mild or early migraines, acetaminophen and NSAIDs are indeed effective acute treatments, especially if taken early. The Canadian Medical Association Journal, for example, highlights acetaminophen, ibuprofen, naproxen, etc. as first-line treatments for acute migraine. Adding caffeine helps. That's why Excedrin migraine, the combo of acetaminophen, aspirin, and caffeine, often works so well. Clinical trials have shown that this combination can outperform some prescription medications for early or mild or not fully evolved migraines. Caffeine actually makes pain relievers about 40% more potent, according to some studies, which is quite significant. Triptans are heavily researched and are recommended for moderate to severe migraines or when simpler medications don't work. There are 7 triptans, and if one doesn't work for someone, doctors often try another because individuals may respond differently to different triptans. Research also shows that combining a triptan with an NSAID like sumatriptan or rizatriptan with naproxen can improve pain relief and reduce the chance of the headache recurring the next day. This combination strategy was even turned into a single pill. Now, guidelines also caution about medication overuse. Using acute medications too frequently, especially those that are short-acting or fast ones, more than 8 days per month, can lead to more headaches. This is especially true for things like combination analgesics like Excedrin and the triptans. This phenomenon is known as medication overuse headache or rebound headache. Gepants are a promising option here because they have the absence of rebound headaches, even with long-term use. In other words, new research suggests that you can take a Gepant without triggering that vicious cycle. And speaking of Gepants and Ditans, studies, including a 2023 comparison in the journal Sapphire fibromyalgia found that these new medications are effective. In that study, lasmiditan, rimegepant, and ibrogepant all help relieve migraine pain with some trade-offs in side effects. Lasmiditan 200 milligrams relieved pain best by 2 hours, but caused more dizziness. Rimegepant and ibrogepant has slightly less pain relief, but also fewer side effects. Ibrogepant having the least side effects. So it's a balancing act. But the fact that we have these alternatives is great, especially for those who cannot take triptans. And then, as I said, timing is everything. Research and clinical experience show that taking your rescue medication early in the migraine attack leads to better outcomes. If you wait until the pain is at its maximum intensity or until you're really ill, the medications are just less effective. There's a study where they gave people one of the Gepants, ibrogepant, during the prodrome phase, before the headache hit, and many were able to prevent the migraine from fully developing. It shows how intervening early is a smart strategy. I do it all the time. If I catch a headache early with something like Nurtec, I may save a triptan day. All this evidence underlines a simple truth. You don't have to just suffer through migraines. There are effective tools to rescue you, and using them strategically with the guidance of science and your doctor can make a world of difference. All right, let's get practical. Here are some rescue tips that I often share with my patients and use myself. 1. Treat within the first 1 to 3 hours of migraine onset. Don't tough it out or wait to see if it gets worse. The earlier you use your rescue medication, the better chance you have at avoiding the migraine. Studies show that medications like triptans and Gepants work best when taken early, ideally when the pain is still mild or during the aura or even the prodrome. So at the first sign, that means the first twinge of pain or that telltale wave of fatigue or aura, act fast. 2. Use adequate doses and form. If you have nausea with your migraines, consider non-pill forms like nasal sprays, maybe even injections, so your stomach issues don't block relief. And use the dose your doctor recommended. Underdosing is a common mistake. 1 Aleve or 1 Advil probably won't touch your headache. 3. Track if your headache returns. Pay attention to how long your relief lasts. Does your migraine come back after 3, 4, 6 hours every time after medication? It might mean that medication's effect wore off. In that case, you need to stay alert for that second triptan dose, for example, or talk to your doctor about a longer acting strategy. For instance, rizatriptan or sumatriptan can be repeated after 2 hours if needed, up to the daily limit. Or you might combine or choose a longer acting medication next time, like naproxen, add it to your triptan to cover you longer. Keeping notes will help you and your doctor fine-tune your approach. 4. Beware of overuse. It's really important not to over-rely on quick fixes like Excedrin or even triptans. Using those too frequently, more than about 8 days a month, can lead to rebound headaches. Basically, migraines that are triggered by the medication themselves. If you notice you're needing rescue medication all the time, it's a sign to discuss preventative therapy with your doctor so you get fewer migraines per month. We'll talk about prevention in the next video. One cool thing is that the newer Gepants can be used a bit more freely without causing rebound, but you still don't want to be popping a pill every single day. Moderation is key. 5. Know your medication categories. This one's a bit nerdy, but it helps. Understand what type of medication you're taking so you can safely mix or rotate them. For example, acetaminophen and an NSAID are different classes, so you may want to take them together sometimes. Many people do for migraines because they work differently, but taking 2 NSAIDs together, like ibuprofen plus naproxen, is usually not advisable. They're in the same class and taking them together can increase side effects. Or if you take a triptan, you generally wouldn't want to take another triptan, meaning if you started with 1 triptan, let's say rizatriptan, you don't want to switch to sumatriptan for the second dose within 24 hours. However, you could take another dose of the same triptan later if needed. If your headache days per month is quite significant, starting with a Gepant early during some of your migraines can be a good strategy, but would not keep you from taking a triptan or an NSAID later on if necessary, since they're different classes. However, always confirm with your doctor. Guidelines encourage a stratified treatment plan. You can have a toolbox of different medications and choose depending on the severity of your situation. For example, you might say, if it's a mild migraine, I'll do ibuprofen and coffee. If it's heading in the moderate range, I'll add my sumatriptan. If I can't take a triptan one day because I already took triptans too many days out of the month, I have a Gepant as backup. This way, you're not exceeding the safe limits of any one drug type. Take some time to learn which medications are NSAIDs, which are triptans, which are Gepants, etc., and label them or keep a list. It can prevent accidental overuse of one type and empower you to combine treatments wisely with medical advice, of course. 6. Rescue behaviors. Meds are crucial, but don't forget non-drug tricks. When you take your rescue medication, enhance its effect by resting in a dark, quiet room if you can, or using an ice pack on your neck or forehead. Hydrate. Eat a snack if you skipped a meal, and try not to spike your sugar levels. I have been able to gain control over my migraine days per month from many months out of the year having 7 to 9 migraines per month to a lot fewer migraines per month with lifestyle alone. By applying these tips, you'll treat your migraines smarter and hopefully suffer a lot less. migraines. It's all about the right medication at the right time and in the right way. And remember, having a rescue plan means less fear of the next migraine. I can't tell you how many patients breathe a sigh of relief when we figure out their go-to acute treatment. It's like carrying an umbrella, knowing you can handle the storm. By tweaking what you take and maybe how you take it, we can fix that boomerang headache problem so you're not stuck in that cycle. So that's your crash course on migraine rescue medications and strategies. I hope you feel more equipped to face your next headache. If you did, give this video a thumbs up and subscribe to the channel. There's a lot more to cover. In fact, in the next video, we'll dive into preventative options, how to reduce the number of migraines you get in the first place. Wouldn't that be nice? You don't want to miss it. So hit that subscribe button and hit the notification bell. And if you have questions or your own tips for stopping a migraine, drop them in the comments below. Let's learn from each other. Thanks for watching, and here's to fewer migraine days ahead.